India started the rollout of its vaccination program on the 16th of January this year. But it would be safe to say that in a true sense, vaccination for COVID-19 has been opened up today. Phase 2 has started from today, and it's truly important because from today, the average citizen who is eligible for the COVID-19 vaccine, that is all those above the age of 60 and those above the age of 45 with comorbidities, can register themselves on the government portal and get themselves vaccinated at the nearest center for free if it's a government center, and at a charge of 250 rupees per dose if it's a private center. So we're speaking now to a very special guest. Mr. R.S. Sharma, the CEO of the National Health Authority, is with us today. This top bureaucrat has in the past taken care of TRAI, that's a telecom regulator. He has been one of the architects of Aadhaar, and now this very crucial implementation of vaccination across India is in his hands for the technology side of it, for sure. Thank you so much, Mr. Sharma, for speaking with us today on ET Now. It is truly a big day for the nation and for the rollout of the vaccination plan. In your assessment, how successful has it been so far?
Well, thank you very much, Tamanna, for having me on your show. I think there is a, let me, before I give judgments on the success or failure, which is not for me to give, but for your viewers and you. Let me say that today's vaccination program is substantially and qualitatively different from what we have been doing thus far. Thus far, the vaccination program was limited to the frontline workers and the health workers, and the approach was essentially different. Now, today, we have begun the program to the citizens of India, those who are 60 years plus, or for those who are between 45 to 60 but have comorbidities. So that way, and the process is extremely simple. It is citizen centric. People can just log on either on the portal cowin.gov.in or through Arogya Setu app, and then they can register themselves on the site, and then they can kind of schedule their appointments. Just to give you the figures, thus far, since morning, we have seen 1.5 million, which is 50 lakh registrations. And if you take at least 2 people per registration, then I think 3 million people, that is 30 lakh people, have registered on the site. And I think we are going to see a big and quantum jump in the number of vaccinations per day, because for the first time, we have enlisted and got the support of the private sector hospitals, which are Ayushman Bharat empaneled hospitals and which are CGHS empaneled hospitals. In those states which are not on Ayushman Bharat, hospitals which are empaneled in their insurance programs, health insurance programs, have also been enabled to do the vaccination.
So, Mr. Sharma, you talked about 15 lakh registrations so far, and if you account for 2 people per registration, 30 lakh of those registered. Are there any broad targets or any assessments that you can share of how many people do you think will be vaccinated in the first week? At what pace can these vaccinations take place? Because registration is one part of it. The other part is to actually have the infrastructure to deliver and administer these vaccines.
Well, I can't guess the numbers, but the only thing which I can say that now we have about 27,000 locations and institutions which are going to be participating in the vaccination drive. We have about 12,600 hospitals which are with the Ayushman Bharat, with the CGHS and other hospitals. So approximately 12,500 hospitals of private hospitals, and of course about the same amount or maybe a little more number in the government sector hospitals. So I think overall the number has gone double by minimum. So I think the numbers will be much larger. But how much will happen, will not happen, I think I must not be venturing a guess at this point.
Mr. Sharma, let me address the reports that have come in thus far from the morning of day 1. And there have been a lot of anecdotes of glitches and difficulty in registering on the app. First glitch seems to be that people are talking about is not receiving an OTP. After that, difficulty in registering, and then a lack of available slots at their closest hospitals to actually get the vaccine. Some talking about a waiting of up to 3 weeks. Why are these glitches taking place, and is it something you think will smoothen out over time?
Well, I think this is a very important question, and people have also been asking me this question. Unfortunately, what has happened is that certain, platforms circulated some application, which is not really the application, because we have not put up any app, so to say, and people were looking for an app, and that's the basic problem. What we have done so far is that we did not want to bring out a new app. It is Arogya Setu app, which is actually held by about 150 million people, 15 crore people. There we have created an extension, so to say, on Arogya Setu app, on which you can register. So that's one channel. Another channel is the CoWin.gov.in, our portal website. That is another way in which you can go to the website and register yourself. The complaints which you are talking about is actually the complaints where people were trying to register on some software or some app which somebody had published, and this was not really the app. So that's the confusion which has been caused. That's one part. Second part is the OTP or SMS, the one-time password not coming. Initially, when there is always the OTP or the SMS gateway has certain capacity. So maybe when people were not getting it, they were again trying and again trying. So there could have been some congestion at some point in time, but I have not seen any congestion. The very fact that 1.5 million people have registered, and 1.5 million times that OTP has gone since morning is clear enough proof that there is no congestion.
Another feedback is availability of slots, and a lot of people also saying that private centers which are impaneled are not yet showing in the options for registration or options as vaccination sites. Is there some time being taken by private hospitals to come on board?
Well, the question is that the private hospitals will be provided vaccines by the state governments. Private sectors will themselves create their vaccination slots. They will have to indicate as to what will be their timetable of vaccinating people, and they will publish that timetable. Only then people will be able to get the slots. So maybe because the whole thing has begun today itself, so today people may not have been able to publish the timetable, or there could have been some other issues. So I think this is only the day one problem. And we have advised the hospitals to publish timetables for next 1 month, because, of course, everything will be subject to the availability of vaccines and the supply of vaccines to those places, and uptake of the vaccines by the private hospitals. But I think all these things are things which will be sorted out. The logistic issues and the sort of uptake of the vaccines and publication of timetables. That's merely a question of maybe today, if they have not published, tomorrow they'll publish. So that will happen.
So do we see everything sort of smoothing out in the next few days?
Yes, certainly, because as I said in the beginning, there is not a software issue. Ultimately, when you make a reservation, you will be able to make reservation against the trains, right? If there is no train running, obviously you can't make reservation. Similarly, if there is no session planned by a hospital, then you can't, that particular slot will not be visible. So those things will happen because the vaccination supply going to the hospitals, hospital publishing their timetable. These two are essential steps before the hospital start showing in the sort of portal or in the Arogya Setu app.
Let me come to the question of vaccination supply, because that's a very important point you've raised there, Mr. Sharma. Do we have an adequate supply, an adequate pipeline for the kind of demand that we are likely to see? Clearly, there's a heavy rush on day one. more and more people want to get themselves registered. So far, there was no question of a problem in supply because there was a minimal group of people who were eligible for vaccination. That has changed now. So are there any hitches you see on the supply side, or there's no issue there?
Well, Tamanna, I will not be able to answer that question because I'm not really in charge of vaccine supply or logistics and other issues related to vaccines. Or their procurements, etc. So I will not be able to answer that questions. In an individual capacity, I can say is that I think the vaccines are available and vaccines will be given. But again, the numbers I'll not be able to give, the estimates I'll not be able to give. I'm only a plumber, I'm only making it possible for the system to kind of use this infrastructure.
That's interesting how you describe yourself as a plumber who's putting things together. So on the other end of the sort of machinery is the number of hospitals. Sir, you said that including private hospitals, we have about 27,000 impaneled. Is that nearly enough? Do we need to get more on board quickly to have a wider vaccination program?
Well, sure, but the question is that if 25, let's do a little bit of maths. If 25,000 hospitals, each one does 100 vaccinations per day, while many hospitals will do thousands also, then 100 at the rate of 100 vaccinations, which is minimal, you will have 25 lakh vaccinations per day, isn't it? So I think that's a good number. But what we are saying is that there is no harm in getting more and more hospitals, and I'm sure the government will be looking forward to making policies in this regard to expand the list further. But I think as of now, the 25,000, if they starts operational, the numbers will be fairly large.
Okay, let me come to some quick FAQs, and I know that these have been talked about quite often. There is a lot of communication out there, but we still hear a lot of this from our viewers and from people at large who are not clear about certain things. So let me take this opportunity to ask you. Now, those above the age of 45 and below 59 are eligible for vaccinations if they have comorbidities. Who determines these comorbidities? Is it left to the discretion of the doctor of that person who will provide the certificate?
No, the comorbidity criterion has been published by the government of India, and you can see as to which sort of disabilities, or which diseases or conditions qualify for comorbidity for vaccination purposes, and those have been publicized well, and they can be seen. I'm not a doctor, but I can, some of the stuff I could also understand. Now, the doctor, any registered medical practitioners can actually certify that the person who suffers from these kinds of one of the problems or more than one problem from that list. So that will be a good enough certificate for comorbidity vaccination based on comorbidity. Now that certificate will be photocopied and actually it will be uploaded on the website on our system, so that we know as to which person got vaccinated due to comorbidity and what were his comorbidity conditions.
Okay. The other question that people are asking is, can you register in a different city from where you are located, and can people get one dose in one city and a second dose somewhere else?
Absolutely. This is actually an extremely flexible system because we are keeping the data related to each and every vaccination in our system, and we are issuing a digital certificate after first vaccination and also after second vaccination. So that certificate is a proof that you got vaccinated. Now you can register anywhere. From anywhere, and you can register for any other place, number one. Number two, you can have a second jab at a different place than what you had at the first place. The only condition is that you will be shown only those facilities which are vaccinating the first vaccine which you have got, because the condition is that if you get first vaccine of one type, then you have to have the second vaccine of the same type. You can't have two different brands of vaccines, for vaccination purposes. So that is the only change. You can schedule an appointment, you can reschedule an appointment. So any time, and you can do it as many times as you want. So it's a completely flexible system. It's not, suppose you are not able to go due to some reason on the day on which you have scheduled vaccination, you can reschedule it. You can cancel the appointment, no problems.
Okay. The other question is, if you cannot register on the website for some reason, some people are not very tech savvy, can they have another method of registering? Can they perhaps just walk in? And I also want to club this with something you've been quoted on recently, saying that in the future, we will also look at home vaccinations for the elderly.
Well, the first question that they can do walk-in is absolutely, the answer is in the affirmative. Yes, you can go and walk in, and if there are vacancies and if there are jabs available, you can get the vaccine. There's no problem on that. So that's one thing I want to make it clear, that there will be, for example, certain centers in rural areas where people may not be able to register completely, and therefore there will be certain seats which will be left for walk-in, vaccinations. We will have to probably mobilize people for these centers to come and get themselves vaccinated. So it is not necessary that you should get pre-registered in order to get vaccinated. On to what was your second question? The at-home type. Now the question is that ultimately, as of now, we are creating. We are authorizing hospitals to get the vaccination done. Now, obviously, hospitals will have to declare the place where they do the vaccination. So its vaccination centers will have to be created. They will normally be in the premises of the hospital. That's what I assume. As of now, we have no plan or facility for different type of vaccinations. But of course, if the government comes with such kind of provisions, we have no issues. But the only non-negotiable thing is that every vaccination which gets done will have to be uploaded in the system in real time so as to get the vaccination certificate. That's very, very important. And secondly, we also want to see that those who are registered are the ones who are vaccinated. There are no proxies. So therefore, identity verification will have much robust. That's what, either through Aadhaar or through driving license or through photo identity card of elections, etc. That's the method that will have to be done.